I know the whole House will join me in sending our best wishes to Her Majesty the Queen for a full and swift recovery. It is a reminder that this virus has not gone away. But because of the efforts we've made as a country over the past 2 years, we can now deal with it in a very different way, moving from government restrictions to personal responsibility. So we protect ourselves without losing our liberties, and maintaining our contingent capabilities so we can respond rapidly to any new variant. And while the pandemic is not over, we have now passed the peak of the Omicron wave, with cases falling, hospitalisations in England now fewer than 10,000 and still falling, and the link between infection and severe disease substantially weakened. Over 71% of all adults are now boosted in England, including 93% of those aged 70 and over. As we have throughout the past 2 years, we will continue to work closely with the devolved administrations as they decide how to take forward their own plans. And today's strategy shows how we will structure our approach in England around 4 principles. First, we will remove all remaining domestic restrictions in law. From this Thursday, 24th of February, we will end the legal requirement to self-isolate following a positive test. And so we will also end self-isolation support payments, although COVID provisions for statutory sick pay can still be claimed for a further month. We will end routine contact tracing and no longer ask fully vaccinated close contacts and those under 18 to test daily for 7 days. And we will remove the legal requirement for close contacts who are not fully vaccinated to self-isolate. Until the 1st of April, we will still advise people who test positive to stay at home, but after that, we will encourage people with COVID-19 symptoms to exercise personal responsibility, just as we encourage people who may have flu to be considerate to others. Mr. Speaker, it's only because levels of immunity are so high and deaths are now, if anything, below where you would normally expect for this time of year, that we can lift these restrictions. And it's only because we know Omicron is less severe that testing for Omicron, on the colossal scale we've been doing, is much less important and much less valuable in preventing serious illness. We should be proud that the UK has established the biggest testing programme per person of any large country in the world. This came at vast cost. The test, trace and isolation budget in 2020-2021 exceeded the entire budget of the Home Office. It cost a further £15.7 billion in this financial year and £2 billion in January alone at the height of the Omicron wave. We must now scale this back. From today, we're removing the guidance for staff and students in most education and childcare settings to undertake twice-weekly asymptomatic testing. And from the 1st of April, when winter is over and the virus will spread less easily, we will end free symptomatic and asymptomatic testing for the general public. We will continue to provide free symptomatic tests to the oldest age groups and those most vulnerable to COVID. And in line with the practice in many other countries, we're working with retailers to ensure that everyone who wants to can buy a test. From April the 1st, we will also no longer recommend the use of voluntary COVID status certification, although the NHS app will continue to allow people to indicate their vaccination status for international travel. And Mr. Speaker, the government will also expire all temporary provisions of the Coronavirus Act. Yes. And today we're taking further action to guard against a possible resurgence of the virus, accepting JCVI advice for a new spring booster offered to those aged 75 and older, to older care home residents and those over 12 who are immunosuppressed. COVID will not suddenly disappear. So those who would wait for a total end to this war before lifting the remaining regulations would be restricting the liberties of the British people for a long time to come. This government does not believe that that is right or necessary. Restrictions pose a heavy toll on our economy, our society, our mental well-being, and on the life chances of our children. And we do not need to pay that cost any longer. We have a population that is protected by the biggest vaccination programme in our history. We have the antivirals, the treatments, and the scientific understanding of this virus. And we have the capabilities to respond rapidly to any resurgence or new variant. And, Mr. Speaker, it is time that we got our confidence back. We don't need laws to compel people to be considerate to others. We can rely on that sense of responsibility towards one another, providing practical advice in the knowledge that people will follow it to avoid infecting loved ones and others. So let us learn to live with this virus and continue protecting ourselves and others without restricting our freedoms.
We must honour the collective sacrifices of the British people and do everything possible to prevent a return to the loss and lockdowns we've seen over the last 2 years. The Prime Minister promised to present a plan for living with COVID. But all we've got today is yet more chaos and disarray. Not enough to prepare us for the new variants which may yet develop. An approach which seems to think that living with COVID means simply ignoring it. This morning he couldn't even persuade his own health secretary to agree the plan. So what confidence can the public have that this is the right approach? Mr. Speaker, let me be clear. The Labour Party does not want to see restrictions in place for a moment longer than necessary. So will the Prime Minister publish the scientific evidence behind his decision to remove the legal requirement to self-isolate, including the impact on the clinically extremely vulnerable, for whom lockdown has never ended? Having come this far, I know the British people will continue to act responsibly, and they will do the right thing, testing and then isolating if positive. What I can't understand is why the Prime Minister is taking away the tools that will help them to do that. Free tests can't continue forever, but if you're 2-1 up with 10 minutes to go, you don't sub off one of your best defenders. The Prime Minister is also removing self-isolation support payments that allow many people to isolate and weakening sick pay. These are decisions which will hit the lowest paid and the most insecure workers the hardest, including care workers who got us through the toughest parts of the pandemic. It's all very well advising workers to self-isolate, but that won't work unless all workers have the security of knowing that they can afford to do so. The Prime Minister mentioned surveillance and the ONS infection survey. This is crucial to ensuring that we can ramp up testing and vaccination if the virus returns. So can the Prime Minister confirm that he has put the funding in place to ensure that the ONS infection survey will not see reduced capacity and that it will be able to track the virus with the same degree of detail as it can today? We can't turn off Britain's radar before the war is won. Ignorance is bliss is not a responsible approach to a deadly virus. It actually risks undoing all the hard-won progress the British people have achieved over the last 2 years. People need to know their liberties are returning and returning for good. But this is a half-baked announcement from a government paralysed by chaos and incompetence. It is not a plan to live well with COVID. Thank you.
Prime Minister.
This is a leader of the opposition who, as I say, has shown an absolutely ferocious grip of the wrong end of the stick.